people are able to transition and be able to see themselves in a much more positive light, even in light of what's happened. So, I actually moved ahead there. So we go to the desensitization part where I go like this, and essentially we tell them, okay, well, so we're going to bring up this memory, and then we're going to process it. So why don't you let the movie play? And of course, you're probably thinking, are you kidding? I'm not going to let that movie play. What? I don't want to do that. Well, that's in effect what we do, but it starts with one image and all of that stuff that we just talked about, kind of there where the person has it in their mind. And then as we start the eye movements, what happens is their brain starts to take over or starts to participate, and that event starts to actually play like a movie. They'll see a short film or a series of snapshots that will have strong feelings attached. And so we'll go along for a little while. And if they get too upset, then we stop and we calm down. And if they want to stop for the day, we stop right there and we make sure that we're calm and able to realize some basic things around safety and security before they go. Most of the time, after a while, when they're comfortable, or at least when they have faith in the process, we'll stop. They'll talk a little bit about what they're processing. We may adjust it just a little bit, and then we'll keep going. And what happens is essentially all of the video pieces of the memory start to fade. It's as if you had a whiteboard in your room, and you put this event or set of events up on the whiteboard, and then started taking an eraser and going back and forth like this, and erase it. And anybody that's ever erased a whiteboard knows the first time you erase something off of a whiteboard, it's not all gone, right? I mean, there's half of it, a quarter of it, there's a little bit of a haze. So you go back again. And that, in effect, is what we do with the eye movements. And for the person, ultimately what we do is we take an event that started out as a video and we translate it into a book. Now, that book is something that they can put on a shelf and let go of it, but they also can pick it up and access the information if they need to. Now, I say that because it's not like we have the flashy thing from Men in Black and go, psh, and they don't remember anything about anything, which actually would kind of be fun. If anybody knows how to make one, please let me know. I would love to get that. But besides that, they still have the information, but now the information is manageable because it doesn't have all those highly charged pictures and sounds and sensory pieces to it. What we've taken what is technically short-term memory artifacts, traces of short-term memory, and processed it into long-term storage. Because if you think about events that went on years ago, even positive events, like think of a positive event that happened to you when you were a young adult. When you think of that event now, you might be able to talk about it, and you've probably talked about it in some detail, but you might have an image, you may have a couple of pictures, maybe you have some recollection of somebody that said a phrase or two, but you're not going to have a full-length movie of that event. Your brain just doesn't store information like that for long. If we did, our brains would be this big, it'd be like the Martians or something, kind of get up there. So anyway, so essentially we're taking short-term memory information and we're translating that into long-term storage, which essentially detoxifies the event in a person's mind.
Who volunteered? You said you'd do anything it takes to save American lives. You're not a liar, right? Or too weak to see this through? This is it. Let go of David Webb. Really give yourself to this program. You're no longer David Webb. From now on, he'll be known as Jason Bourne. Welcome to the program. Do you remember now?
I remember. I remember everything. I'm no longer Jason Bourne.
So now you're gonna kill me.
No. You don't deserve the star they'd give you on the wall at Langley.
If y'all couldn't tell, I love this movie series. One of the reasons for that right there is that little spot right there where he says, "I'm no longer Jason Bourne. I'm David Webb." That is where we take folks to the place where they can say, "I'm no longer a failure. I'm no longer a murderer. I'm me." And that's what we look for. There's more that we could say about some of the technical pieces of the therapy, but I think maybe at this point it might be good to take some questions. If anybody's got questions that they would like to bring up, we've got a few minutes before lunch. I'd intended to try and do a little bit of question and answer in the middle there, but just didn't quite find a way to do it. So, yes, ma'am.
Do the way people learn, does this have an effect on how they perceive PSD? I don't know if perceive's the right word, but the way people learn, does that have a bearing on how they process the PTSD effects?
You're asking how a person basically learns, like their natural learning process, does that affect how they experience PTSD symptoms? Yes, in fact it does. There are elements of memory, all of those components of memory that I mentioned are usually there in traumatic memories, but the certain pieces are more important to a part that's important to one person is actually not necessarily as important to another. For instance, very analytical personalities. Part of my background is in personality theory. I do quite a bit of work in personality testing and looking at that element of interaction with people. And there are very analytical personalities that the information or the definition is the most important piece of any situation. And they organize everything around that. So the idea, I'm a failure, becomes the central organizing thing for them as who they are. And so for folks that are like that, we end up working a lot more and focusing much more on those ideas. Whereas if a personality is more emotionally based, meaning 2 of the 6 basic personalities feel first and think second as they begin to interact in situations, for those 2 sets of people, the emotional components are far more important than the idea. So the idea is there, and it is a part of the puzzle, but once the emotions are gone and out of the situation, once we've processed the emotional side out, then the idea pretty well naturally falls away. We don't really have to work on it all that hard. Whereas for the first set of people, the more analytically based, we can end up spending time, several sessions, strictly on that belief, where we have to begin to attack the belief from different angles. So yes, it actually does make a difference in terms of approach. Now, every personality can do EMDR. Well, I say everybody. Vast majority of people can do one of the versions of EMDR. We have research studies for folks who are blind who can't do the eye movements, but we have other adaptations to where we can do hand tappers or audio bilateral stimulation to work with them. Anybody else? We get parting thought? Yes, sir.
I don't know exactly what I'm going to ask, but I've got a friend who I'm often called to help him. and it's during a very high stressed battle with his PTSD. He often turns, you've mentioned it, the alcohol. He'll go to cocaine. How do we, as brothers and sisters who see someone suffering, how do we try to help escort them to get help, like from you, without? Oftentimes, I try to do one of these, but do I need to grab the coat and take him without? I want him to continue to trust me as a brother, so I don't want to alienate him. But how do we walk that line?
Yeah, and it absolutely is a line to walk, because particularly when folks are using coping styles to deal with their symptoms that are problematic and creating trouble, that can become, if it's severe, like if we're talking something in the vicinity of like severe alcoholism, to where essentially a person ends up being an alcoholic, many times we'll have to treat that first. And a lot of times there could potentially be a brief stay in a treatment center that deals strictly with alcoholism or drug addiction, if that's part of the process. Getting a person to that spot is absolutely a challenge. It's a negotiation that pretty well, to have access to them, it has to start as a friend and as somebody who's trying to give them support, get them some information. If there are points when they're willing to take some information, maybe you can sit down and just kind of talk about something, take them a flyer from a conference. Say, hey, I was kind of over at this conference, and this guy was up there talking. He said that, sometimes folks have these kind of things going on in their head when, they feel like this. Do you ever have that? To where you kind of normalize the experience or help him to see that other people have the same kind of experience he does, and then maybe show him, what do these other people do? What are the options for them? Well, there's these people over here at this group, and they talk about this, and they try and deal with this in another way besides drinking and things like that. But it absolutely is it's a process of invitation, because one of the biggest challenges we face, I think, with PTSD specific, but also in terms of coping like that, is access. Because many times folks are very, very reticent to come out and engage with other people. So maintaining that contact as a friend and a colleague is really a wonderful place to be. And truthfully, what I tell people is I pray about it. I ask for intervention, help, and then you look for the opportunity. You look for maybe a teaching moment, and then try and be prepared with something like you're already charged up to have information, or maybe a name of a counselor to see, or some sort of somebody in the community he respects, if he has a pastor he respects, or maybe a business partner or someone that has some authority in his life who would agree. Maybe we get him to talk to them, or you and this third person come together and kind of talk a little bit about some other options. So, great question, though. Very challenging spot.
Great. Thank you, Dr. Nat. Please join me in giving Dr. Nat a round.
Thanks very much. I appreciate it.